Hi there, I'm Mabel Jong, and you're watching the World Healthcare Congress interview studio. I'm so pleased to have Jeannine English in the chair right now. She's the president-elect of AARP. Jeannine, thanks for stopping by.
Oh, thank you. It's a pleasure to be here.
Well, it certainly seems like you have a very big job because your membership represent a lot of people who are going to be very concerned about how the healthcare landscape is changing. Can you address some of the concerns that they might have about what's happening in healthcare now?
Absolutely. We have 38 million members, and they are concerned. They're very concerned. They're very worried. Many of our members are still working. We have between 40 and 50% of our members still working or trying to work. You know, with the job situation, many lost their health insurance and have not been able to get the insurance that they've needed. And so from their perspective, just making sure that they are able to get the insurance so that they can get the type of health care they need at a reasonable price is crucial. And many of them are not in the job market. So looking at what's happening with health insurance is their number one priority.
Mm-hmm. And do you think that there is enough information for them out there? I know that the exchanges, when they come online in October, is supposed to provide more information, being more transparent about what healthcare options are available to people, and people in your membership specifically. So do you think that people have the right information, or are there a lot of myths out there as well?
Well, there are definitely a lot of myths, and that's really one of the areas that AARP is working on. We've had a campaign called You've Earned a Say, and in that campaign, we tried to hear from our members about what their concerns were, but also provide them the different options and a real independent voice for those options so that they knew that they were getting the right information to be able to make the right choices. And we'll continue that. We are committed and have been committed to the Affordable Care Act. That was one of the things that we supported, and one of the reasons that we're very excited about this conference and what's happening at this conference is the information is so relevant. We have these new exchanges that are being set up in the states that are looking at the individual needs of people in the states, and many of our members want to make sure that those needs are addressed. Mm-hmm. And that's what we're talking about at this conference. Mm-hmm. Those exchanges and how they are being really tweaked to address the individual needs of the states.
Right. What are some of the good things that are happening that you're encouraged by?
Well, I think that one of the things, or a number of the things, include looking at the overall health cost curve and recognizing that it can't sustain itself, and recognizing that there are ways that we can bring a collaborative approach to the delivery of health care to make sure that we're looking at the entire individual and their needs rather than the fee-for-service basis where more volume was the real mandate rather than greater cost control and greater care.
Mm-hmm. You mentioned that a good portion of the membership of the AARP don't have insurance at all. So, or please restate what you had said to me earlier about those people that really don't have insurance at all. Will the Affordable Care Act address those needs?
Well, that's one of the reasons that we are very, very supportive of the states setting up individual exchanges to make sure that everyone can get affordable insurance. There are 27 states that are setting up the exchanges. There are 17 states that have indicated that they do not want to set up exchanges. We're working diligently with governors and the legislature to encourage the states to set up these insurance exchanges and modify them based on the needs of their citizens. We do have a number of AARP members that lost their jobs during the downturn in the economy, and with their jobs, they lost their health insurance. Mm-hmm. And so the exchanges will really be their only real possibility to get the insurance that they need.
What is the message that you're leaving with people here at the conference?
I think the message is that we need to look at ways to reduce the cost curve, and it's not just looking at ways to cut Medicare or Medicaid, but it's looking at ways to really streamline the cost so that we can do things like bulk discounts for prescription drugs. Right now, Medicare cannot negotiate those bulk discounts, and that would save an enormous amount of money. Also looking at transitional care so that we're not shifting people in and out of hospitals, which costs a lot and also has a huge impact on their overall quality of health care.
Okay, Jeannine, thank you so much for your time today.
Oh, thank you,
I really
Mabel.
appreciate it. Hi, Mabel Zhang. Thanks for watching.